Hello, my esteemed viewers. Welcome to another exciting episode of the Voices for Self-Care Podcast Season 2, the #1 podcast that advocates for self-care in Nigeria. Today, again, we bring to you another exciting and engaging conversation that you definitely do not want to miss. Today, we're going to be talking about pharmacists as self-care champions, and we're going to be having a very interesting guest who is going to be dissecting this topic with us. We'll go on a short break right now, and when we come back, I'll let you know who it is. We'll be right back. Welcome back. This is the Voices for Self-Care podcast, and if you're just joining us, a warm welcome. Today we'll be talking about PSNF's roadmap for integrating pharmacist expertise into SRMH, self-care for SRMH in Nigeria. And we're talking about pharmacists as self-care champions. Of course, I'm not going to be doing this alone. We have someone very interesting, someone very learned and seasoned who is going to be discussing this topic with us. Our guest today is a seasoned and exceptional, in fact, phenomenal pharmacist, I would say. She is the program manager of the Pharmaceutical Society of Nigeria Foundation, PSNF, where she guides her team in strategic programmatic direction and support. She possesses an in-depth knowledge and experience in the Nigerian policy sector, implementation and healthy system strengthening, where she works with policymakers, formulators, and partners through advocacy for the need to use evidence for development of policies and rational decision making. Specifically, this phenomenal guest has led her organization to advocate for the review at the national and state level for the tax shifting and tax sharing policy, where she saw the inclusion of community pharmacists to be providers of quality healthcare services and commodities. Additionally, she led the advocacy for the review of the essential medicine list, which saw the inclusion of a number of commodities like the DMPASC, aka Cyana Press, just to mention a few. This shows you that our guest today is well equipped and seasoned to have this conversation with us. Wherever you're watching us from, please put your hands together for pharmacist Ijoma Nwako. Yay! Bravo!
Thank you.
Did that sound like you?
Well, I'm still thinking.
No, that is definitely you. It's definitely you. Welcome to the show.
Thank you.
It's such a pleasure to have you here,
I love it. I love being
I'm
here.
excited because we have, throughout the course of the show from season 1, we've discussed with a lot of implementing partners. We've talked to people handling demand generation, service delivery, coordination. We've had people from the FMOH. And right now, we want to talk to the pharmacist. And you are just the best person to speak to us on that.
It's a pleasure.
Yes. So I'm excited. So today we're talking about pharmacists as self-care champions. We're talking about, we want to know, what does that even mean in the first place? What does pharmacists as self-care champions mean?
Pharmacists are self-care champions. If you ask me, I'm not being, not because I'm a pharmacist, but pharmacists are actually self-care champions.
Right.
Because self-care actually does start from the community. It starts from the household, and from the household, the next port of call, or the first port of call, is usually the pharmacy. And that's where the community pharmacists play. So community pharmacists are full-fledged pharmacists, but they also, serve the communities in which their pharmacies are located. So definitely health-seeking Nigerians or individuals or the communities or families do go to the pharmacies as their first port of call. So
definitely pharmacists
are self-care champions.
Great.
Yes.
So today we're going to be talking about Pharmaceutical Society of Nigeria's Foundation Roadmap for integrating the pharmacist expertise into SRMH in Nigeria. And the first thing first, before delving into the conversation, is, the whole purpose of this podcast is to create more awareness around self-care. Okay. And I want to hear from the pharmacist's point of view what self-care is exactly and what self-care is not.
So I would say that self-care is when families, individuals really seek to promote health, prevent illness. And when we say promote health and prevent illness, mentally, physically, spiritually, And they do that with or without the support of a health worker. So that's essentially what self-care means. And what self-care is not, in very simple terms, self-care is not self-medication.
Right.
That's what it is for us from my angle. Self-care isn't self-medication.
So how do you explain this to, really, because how do you explain this to the community or to individuals who believe that going to the pharmacy to just get medication without prescription right now is self-care? Or how do you draw that line between actually going to get over-the-counter, medications or contraceptives, for example, and just maybe HIV self-testing kits or something? How do you explain to them that that is not self-medication, but that is self-care?
So even from the conceptualization of those medicines or those commodities, dosing, route of administration, how it's used has already been taken into note, or into, the whole concept that this particular commodity wouldn't need the services, or may not need the services of a professional or a healthcare worker. So all of that is taken into the conceptualization of the particular commodity or the medicine. And that's also what has guided classifying medicines into OTCs or prescription only, and in some other clients, what we call the pharmacy or pharmacist-initiated medicines. So these are all classified, taking into cognizance that. So, but one thing I think people also, and that's what makes pharmacists quite unique, is that even in trying to access self-care, if you look at the healthcare professionals, the pharmacist wouldn't leave a health seeker or a client or a patient without providing pharmaceutical care.
Right.
For every commodity or every medicine that goes out of a pharmacy, there's pharmaceutical care, which also includes counseling. So counseling must go through, because that is who a pharmacist is. A pharmacist counsels. So there's always that patience with pharmacists, because they know that it is make or break or make or mar for the health seeker.
Right.
So just having the medicine is not enough, but being able to say, to counsel, you take this particular dose at this time, don't take it with this, or do this at this time, or wait for 12 hours before you're able to take this. So these must go even with the self-care commodities or medication or whatever else goes in.
Right. So I think what you mean by, when you say self-care is not self-medication, you mean that a health seeker or a client or an individual right now, in plain terms, cannot just decide on their own on what medication to take without first seeking a healthcare provider. In this case, maybe the counseling of a healthcare provider, right?
So yeah, that's part of it. That's actually part of what I was trying to say. And then also the fact that not everything goes under the radar of self-care, because there has to be a line of demarcation, know when to actually pursue for proper clinical tests or clinical evaluation before the next step can, because there's a thin line between self-care and self-medication.
Exactly.
Actually. So it's now the pharmacist who actually should also be able to determine at that level, because remember, self-care goes on within the community. So the hospital is like the other level of care. So the pharmacist also at that point is able to determine, we're beginning to cross the line and we think you should go in for full clinical evaluation.
Right.
So we're sending you to the next level. Take, for example, the HIV self-test. So the client comes in, purchases the kit, and goes back. So even before the client moves from a positive test on the self-test kit to
The
being put on or placed on antiretrovirals, there has to be a confirmatory test done at the lab at the hospital, so wherever. So that's how actually self-care works. So at that point, the pharmacist has to have the knowledge of, actually guiding that client right. So.
Right. So you just, your last statement just touched on a little introduction into my next question. Which is great. So you spoke about how unique pharmacists are, when it comes to self-care, which begs me to say, I mean, what unique thing or what unique angle do pharmacists bring to self-care that other stakeholders might miss?
Oh, I love that question.
Right.
So, and there was something I said, even from the conceptualization. So we have industrial pharmacists. The industrial pharmacists are also there to even produce. And there are pharmacists within at the stage of conceptualization. All the tests, all the clinical trials, there are pharmacists there. And then at the point of manufacturing, industrial pharmacists are there. And then when the channel from the industry to the consumer is still the pharmacist. The moment a patient or a client moves to the hospital, it's no more self-care.
Right.
So it's still the pharmacist at the community pharmacy, at the community, that is still the gold standard,
like
so the rallying point
of self-care.
So hinged, exactly, that's the word, hinged on self-care. So the pharmacists are so unique because the whole chain, up until when self-care is cut off, is usually the focal point for self-care.
Right. So my next question is, there's this perception about pharmacists that pharmacists are just responsible for dispensing drugs, medication in this case. So how has pharmacists, or what role has PSNF now played in shifting the role of pharmacists from just merely dispensing medications into being actual advocates and educators of self-care?
Oh, wow. Okay, so when you introduced, you had that little bio, you mentioned the task shifting, task sharing policy. And so the task shifting, task sharing policy, I like to say, is that overarching policy that has given strength to other policies as well. And the task shifting, task sharing policy, because of the imbalance in human resource for health, HRH, has also given pharmacists, especially community pharmacists, that leverage to be able to provide expanded FP and even primary healthcare, family planning, and other primary healthcare services, because of the uniqueness of the pharmacies and the pharmacists. Now, what is that uniqueness? Studies have shown that over 80% of Nigerians, first of all, visit the community pharmacy for whether counseling or whatever health information, up until the point of accessing medicines, even before moving to a hospital, the level of the hospital or hospital care, or what we call more clinical care. So that task shifting, task sharing policy has provided that. And then I think there's also that misconception that pharmacists are only there to dispense.
Yes,
dispensing is just one drop in the ocean of what pharmacists do.
Right.
I know more of the conversation, or most of our conversations, will be hinged on the community pharmacists. There are also other aspects of pharmacy or other branches of pharmacy. But I know we're talking about community pharmacists right now. So for community pharmacists, they do so many things. Remember, I talked about pharmaceutical, there's differentiated care, there's pharmaceutical care that goes into it, which is not just counseling. So there's a whole lot that goes in there. And pharmacists always have the ears, or the community also loves the pharmacists. They open up so much at that point because they feel the pharmacist is just there within the community, is reachable 24 hours, quite accessible. I can pour out. He's within the community. He knows us. He's seen as that all in all. So that's the uniqueness, and that's the beauty of what PSN Foundation has done. Also with the task shifting, task sharing policy, but that didn't go without adequate evidence. So NDHS, that's the demographic health survey, talked about 80% of women seeking their family planning needs, first of all, visiting a community pharmacy. So that also helped see the review of the policy. So I would say that PSN Foundation has done a lot in that regard. And then other policies that have also spoken or speaking to self-care and other aspects of health have also seen that the community pharmacies are captured and pharmacists are captured in those documents, because we can't leave, if we have 80% of Nigerians going there, that's a
huge number.
Huge number.
True. Is there any particular example? Share with us if there's any particular success story where PSNF has directly, improved access to SRMH, self-care SRMH services in a particular community.
Okay, so the thing about PSN Foundation is that we're largely a policy and advocacy organization. Right. So I wouldn't say we don't work within the communities. Okay. Right? So we set the ball rolling in terms of policy, in terms of churning the focus of the policy makers and the formulators and those who really take the decision makers to actually look at what the issues are. So, but the beauty of what we've done is that beyond the PSN Foundation, many other organizations have been able to draw strength from the work that the policy and advocacy work that PSN Foundation has done. For example, in the Integrate E project that we've been implementing as a policy and advocacy arm, the waivers that we got to allow community pharmacists and the patent and proprietary medicines vendors to be able to provide expanded family planning and PHC services, and the review of the task shifting, task sharing policy saw a catalytic response at the national and 11 states in Nigeria. So the service delivery was able to go in and train these providers to be able to provide those services. So you can see the ripple effect of what PSN Foundation has done. And it's also interesting to note that those same policies have also seen a lot of changes, a lot of direction going towards the private sector, and how the capacities and the strengths that lie within the private sector can be harnessed to actually open up more services to the teeming population within that level. Another example was it was 2020. PSN Foundation also collaborated with John Snow, with the federal government, and we provided about 296 community pharmacists across 4 states were sensitized on HIV self-test and pre-exposure prophylaxis. So the self-test kits, and we got success stories where, based on the training that they got and the engagement and the awareness that was created, some community pharmacists banded together and had community outreaches, and they were able to reach their communities and their target population with more information and access to HIV self-test.
Oh, that's amazing. That's a great success story.
Yeah, so
really.
That's beautiful to note.
Let's talk about the review of the National Self-Care Guideline. We know that the NSG guideline has been existing since 2020. NSG for SRMH has been existing since 2020 and is currently being reviewed. The first review process has started in Kaduna. Unfortunately, PSM was not there at the time, and that is why I'm giving you this opportunity to kind of make your own recommendations or what you would like to see as regards any intervention you hope to see in the new guidelines, specifically regarding the scale up to include adolescents and elderly health, women with reproductive age and all that. Yes.
That's beautiful, because for quite a while, I've been a very strong advocate of moving self-care from just SRMH to RAMCA, so that policies, because there's one thing we also try to do when we're mapping policies and looking at the policy space. Policies have to speak to each other and not just cherry pick and choose, and then some, that isn't lacking. Yeah. So that helps with coordination. Of course. So I've been a voice, saying that we shouldn't just look at it as sexual and reproductive. We also have to look at other aspects of self-care. So this is very cheering news that other parts of, especially the adolescent and elderly, and I think that community pharmacists are quite poised, because at the community pharmacy, education, counseling for the adolescents around puberty, around what they hope to see. Sometimes, because sometimes adolescents are actually very funny, they actually go out to get their information rather than get from home, maybe for fear of being, vilified by their parents. So they would want to probably go to a healthcare professional. So it's important to have information sitting in pharmacies. So pharmacists have to, maybe with some little training, have that done there. And I think it's also important that as this is happening, the regulator in charge of the practice, the personnel, community pharmacists, that's the Pharmacy Council of Nigeria, is also carried along, because there's something called the mandatory continuing education, or the MCPD, that the pharmacists, we do that after some years. So it's just like a mandatory professional, education that we have. So bits and pieces of self-care could also go in there, so that the pharmacist is able to refresh his memory or her memory on what self-care is all about. And then for the elderly too, there's also something called polypharmacy in the elderly. So most elderly people are usually on 4 or 5 or even up to 10 medications for different ailments. And pharmacists are quite poised to talk about polypharmacy, because there's usually interaction.
Sorry to cut you short there. I would like you to explain further, because for those that are not pharmacists, please, I'm not a pharmacist. I'm sure you two watching me, you're not a pharmacist. So please, what is
polypharmacy is having so many medications at the same time.
All right.
And so it's usually tricky. So I'll give an example. 2 conditions that are quite common in the elderly, diabetes and hypertension, they are like this.
True.
So
like 5
and
or
their
6.
medications too are like they don't go. So the pharmacist should be able to counsel her, right? So there should be information on polypharmacy. So something like that for the elderly is very important. Even as little as having leaflets in bold prints because of their eyes.
True.
So like little changes like that would see better health outcomes for the elderly. So those are the kind of things that you would want to see.
Right.
Another aspect that would really be very important to stress is the referral system. The referral system is quite from the private to the public, or vice versa, is really very weak. And I think it's something that all stakeholders really need to take into cognizance. And this is important because it also prevents healthcare workers from taking on a lot, or taking on what they can't handle, because most times we have people from the community pouring in, crying, you have to help me do this, and then out of some empathy or sympathy, the healthcare worker may want to take on more than he can chew or she can chew, because the referral systems are weak. So I would want to, as a pharmacist, I would want to refer A to a hospital, and then because the referral systems are weak and the person gets there, we're not sure the person is going to get that kind of care. You have the healthcare worker trying to take chew more, bite more than they can chew. So referral is really very critical. Referral, so that we don't move from self-care to self-medication, or diagnosis, and then self-management, and then on, and then ultimately
back to zero, of course,
or even losing a life. So we wouldn't want to see that. So I think that is important. Another important aspect is we have to start looking at digital channels.
I was just going to do that. That was the next question I was going to ask you. That how important do you see digital channels and technology in improving pharmacy access, pharmacy support
Yeah.
Right. So
Yeah,
go ahead and
there's
speak on that.
There's a lot of digital telemedicine. We have pharmacists who are probably away from their pharmacies, you know, just with a phone.
Right.
Clients calling, what do I do? That's already digital.
Already.
That's already online. That's digital. That's. But the beauty of it is that the Federal Ministry of Health isn't also sleeping. There's an e-pharmacy policy which is on the table of the minister waiting for approval.
Okay.
That's the e-pharmacy policy, and then the regulator is already waiting. That's the Pharmacy Council of Nigeria to finish up on the guidelines and roll out, because the guidelines would actually guide the implementation of the policy, which means that the actual implementation lies with the regulator. And this was why I made reference to having the regulator in the room when conversations are happening. So, interestingly enough, the PSN Foundation is implementing the e-pharma for FP, so the e-pharmacy for family planning, where it's looking at opening up the digital channels for family planning services. And quite interestingly, there are a lot of young users on such platforms, so even adolescents also accessing that platform, because it gives them that discreetness,
right,
where they don't have to have that
stigma. Yeah, of course.
Yes, or the backlash from providers, you know, what are you doing here, and all of that. Why should you? You're not married, you're a child, you know. So for the adolescents. So, and then sometimes I understand how it feels having a child, but sometimes it's not just even for the product, it's just information. I heard this from my peers. What is it really all about? You know, so it's better that education goes out. It's very important to prevent myths and misconceptions, which is really very rife in family planning, or SRMH as the case may be.
Thank you, Ijoma. That's so profound. We are going to be winding down soon, but we're going to have to go on a short break. When we come back, we're going to be talking about recommendations for pharmacists to sustain self-care over a decade. And when we come back, it's still the Voices for Self-Care podcast. We'll be right back. Welcome back. This is still the Voices for Self-Care podcast. We've had an engaging conversation with Ijoma, the program manager of the Pharmaceutical Society of Nigeria Foundation. We are talking pharmacists as self-care champions, PSNF's roadmap for integrating pharmacy expertise into self-care for SRMH in Nigeria. And the conversation continues. So Ijoma, we've had a very interesting conversation so far. Thanks to you. I particularly now see the importance of pharmacists in the self-care intervention process. And of course, I'm sure my viewers are seeing it. So I'm going to ask you to recommend. What would you recommend? What would your recommendations be to ensure that pharmacists remain at the center, or the hinge of self-care for a really long time?
I think now there are policies in place, largely. So we have to start looking at integrating pharmacists fully into the flow. And one way, which is something that has also been lacking, is data.
Right.
Gathering data from the private sector. The data in the private from the private sector and in the private sector is quite chaotic. Now we dial back again to what I said initially about evidence. 80% of Nigerians, and the government doesn't really have eyes into what goes on there. So how exactly is the government making informed decisions for Nigerians? So I think for us at PSN Foundation, what we would love to see is how data can be harnessed from the private sector. A whole lot of interventions are, going on, being poured. A lot of resources are being poured into that space. So how exactly is it being used? How are resources being used? What more resources what resources are needed? We may not even have, it may not be human resource, it may not be financial, it may be skills, it may be capacity, so all of that. Then another thing we would love to see is a sustainability. Because
Sustainability is key.
anything we do now is sustainability. So do we dial back to pre-service training? And when we say pre-service, we mean from the schools.
Right.
What's the curriculum saying? Has the curriculum been updated? And that is also dials me back to why I said the regulator must also be there, because the regulator has that prime responsibility to ensure that curriculum is always up to date. So it's also for the stakeholders to move the focus or shift the focus of the regulator to say, I think it's time we need to have the curriculum updated. And then, of course, I talked about data, also have data from the private sector really speak. So I think these are things that we as stakeholders, and when I say stakeholders, because we are varied,
of course,
there's government, the partners, there's also the private sector, those who can do some of these as a CSR, so have this, and that's where advocacy also comes to play. So really drive and put their eyes into what is important. So I think I'll just leave it at
thank you so much. Those are profound recommendations, really. Thank you so much.